Hello everyone, welcome back. I know it's been a little while since we've spoken and produced a video, but I thought it's important. I've had an interesting time of late. I've been marking work, helping students, and I thought it'd be useful to just do a short video, just going through some helpful tips and hints on how best to study and retain what it is you study within the broad field of anatomy. Having helped a lot of students over the past years, I realized that there are two ways in which you can learn anatomy. One is to learn anatomy for the now, learn it in the moment. In other words, we learn it, we try and apply it to pass an exam and forget it. But that doesn't actually make for more fundamental learning or concrete learning. So how do we learn in order to retain what it is we need to know and we need to apply in order to either help clients, patients, colleagues? So how best do we go about understanding anatomy? So if you've read Making Sense of Learning Human Anatomy and Physiology, written by myself and my great co-author Jane, you'll learn that we've devised and organized the chapters into various themes. For example, how do we do anatomy? How do we understand anatomy as a language? And that's where I'd really want to start. When we learn anatomy, don't think of the science, think of the art. Think about learning anatomy as a language. Understand how the words of anatomy come together. And this brings me back to one of the most empowering lines that I've ever learnt in song. So I often tell my students, if I can't find the answer in science, I turn to song. Think back to the sound of music. Think back to those empowering words of Do-a-deer. And it says, when you know the notes to sing, you can sing most anything. In other words, when you understand the language of anatomy and you understand the breakdown and origin of words, you can apply it. So let's take a simple one, tibialis anterior. If you know that the tibia is a bone, anterior means the front of the body, the muscle tibialis anterior starts to take form. You can start thinking, well, the tibia is in the shin or the lower leg, and it's on the front of the body. It gives you a guide, a roadmap on where you may think you would find that. Once again, if we look at a muscle, for example, the supraspinatus, and we know that the word superior means towards the head, and spinatus comes from the word spine, and that's the spine of the shoulder blade, the scapular bone, and it lies above that. We can understand where we would find that. Or rhomboids are named because of their shape. So what's important? Let's go through and think about when you study anatomy, what I often tell students to do is make a list of the words. Do you understand what the word buccal means? Well, the buccus from the Latin is cheek, so buccinator, if you come across that muscle, must lie within this region over your cheeks. Think about how the words anterior, posterior influence the names of muscle. Think about bi and tri and quad. Give you an understanding of how many heads there are within a muscle. Think about the shape of a muscle. Deltoid, delta, triangular. Okay? Latissimus dorsi, latissimus broad, dorsi pertaining to the back. Broad muscle that actually connects your back to your shoulder. Fantastic muscle that is. Pectoralis, pectoral meaning chest. Pectoralis major, major meaning big. So it's a big muscle that occupies the chest. Rectus, I love that name, rectus, upright. Abdominis, upright abdominal muscles that help to maintain your posture. Gluteus, from buttocks. Maximus, minimus, medius, simple words to indicate size. Adductor, magnus, large. Longus, long. Brevis, from the English word brief, short. So once we start learning the names, we can start applying it as opposed to just rote learning. We can start breaking down the names in order to better understand why that structure is named, or how that structure is named, or what it does. So if I have flexor carpi ulnaris, I know that that muscle, for example, has to flex. It lies over the hand and wrist, the carpus, and it's towards the ulnar side or the medial side. So it gives me a roadmap of thinking, okay, where would I expect to find that muscle? Occipitalis, if we know that occipital is the posterior aspect of the cranium, occipitalis is the muscle that lies over that. But then again, what's important for you to know when you learn anatomy is make up a little man, cut it out of board. Think about the organization of the human body. So if we break ourselves down into the simple component, we are all a bunch of cells. And the study of cells is called cytology. So when we look at the letter C-Y-T-O, cyto, it pertains to cells. So we may look at cytoplasm, which is the gel-like substance found within the cell into which the organelles, the little organs, are found or suspended. The study of tissue, so when cells group, they form tissue, is histology. So we know that there are different tissue types. When tissues group, they form visceral organs. When organs group, they form systems. And systems eventually group to form the whole. But when things go wrong, we need to break it down again. So we look at the whole and we think, are there things wrong with different areas in the body? Are there things wrong with different organs? Are there things wrong with the tissue level? And more importantly, is there drastic or dramatic change within the cells? So, or understanding how the human body is arranged gives us an understanding of how we can approach the treatment when things go wrong. So my final tip in the short little spurt is think about the language that anatomy has. It has a unique way of describing things, and a unique way of talking about things. You enter into a world where you become unique because you understand the instruments of the language we use. So we know that when we use anterior, we're talking about the front. Superior towards the head. Cranial towards the head. Caudus means tail. So caudal towards our tail, towards our feet. Another word for inferior. Think about these words. Think about the names you encounter when you study anatomy. Break it down and try and work out if you can make sense or derive meaning from a name. Our next video within this series will look at some learning aids that you can build, models that will help you understand how structures are arranged, that will further enable you to apply the knowledge you learn, but more importantly, retain it. Learn Anatomy is about helping you retain, not just learning for the now and forgetting about it later. Happy learning from all of us in the Learn Anatomy team. Hats off to you. Pollikus up. That means thumbs up, as you well know. And we extend a manus, a hand, to help you. See you soon.